global goals and promote national capacity and voices, the Lancet NCDI Poverty Commission and Partners in Health are working with selected countries, including Zambia, to undertake a series of analysis consistent with the global aims and objectives. Ladies and gentlemen, with their support, Zambia has been able to establish the NCDI Poverty Commission, and this was done in 2018. We have heard from Professor Goma why it has taken time for us to get this report ready for launch, and nonetheless, we're really happy to be here to actually launch it. This commission, as you're aware, is co-chaired by the Ministry of Health, and my organization serves as the secretariat for the commission, and we're deeply honored and privileged to serve in this role. The commission consists of more than 20 stakeholders that are led by the Ministry of Health, include community voices by representation from civil society. We have inclusion of academic institutions and other implementing partners. The mandate of the commission was several-fold, but I'll just highlight 3 or 4 of them. And primarily, especially as a researcher, it was to assemble baseline data regarding disease burden and intervention coverage in relation to household poverty and individual disease severity. Further, to assemble this data and understand the local costs and financing as well as governance. Thirdly, it was to document innovative local policies and service delivery models. As you're aware, there's a lot of work that's already being done on the ground and lots of good lessons to be learned. So how then can we move these lessons to actual broader implementation and achieve wider impact? Also, the commission was to undertake a priority setting exercise for expanded health investments, and we spent some time discussing these priority diseases. The Zambia NCD Poverty Commission has successfully defined the burden of disease in the country, and this work must be commended. We now know that 37% of diseases and death in Zambia are being caused by NCDs and injuries. We didn't have this information before to guide policy as well as our investment into the sector. The commission was able to come up with this work after rigorous data collection and analysis and the identification of more than 200 conditions that have to be reviewed. They have been able to work downwards towards identifying 54 critical conditions, and we anticipate that further work will further synthesize this to 10 priority conditions. I am happy to announce that the NCDI Poverty Commission has completed their work, and that this report will be launched by the Ministry of Health in collaboration with World Health Organization and their representation here in Zambia. Ladies and gentlemen, on behalf of my team and consortium partners that worked on this, we remain entirely grateful to the Leona M. and Harry B. Hemsley Charitable Trust because they have funded us to do additional work to support the NCDI. CIDES will be moving forward to implement the PEN Plus project, which will be looking at how to further improve awareness and the skills of providers that will be providing NCD support in various public health facilities. PEN Plus builds on the World Health Organization's package of essential NCD interventions for common NCDs. We're truly grateful for the support from this charitable trust and the ability to carry on this work on a much broader scale. We look forward to working with all of you on this project, knowing that the strength in numbers, we can win the fight against NCDs and injuries for all Zambians. Thank you so much for being here with us and to support the work that has been led by the Ministry of Health for the last 3 years or so. Thank you.
Thank you very much, CEO for CIDES, for those remarks. And it's good to see that the report is here. And I'll just call on the country representative for the World Health Organization in Zambia, Dr. Bachiaita, to make a few remarks and hand over this report to the Ministry of Health, who are the main consumers. Dr. Machaito.
Thank you so much, Director of Ceremonies. Like the people before me, I'll write on the protocol that has already been given. So the Permanent Secretary, Minister of Health, Professor Lakson Kasonka, the CEO of Center for Infectious Disease, Dr. Izukanji Sikazwe, members of the civil society present here and the commission, colleagues, invited guests, ladies and gentlemen. It's now good afternoon, isn't it? Yeah. I'm honored to be a part of this meeting this morning as we start a journey on addressing prevention and control of non-communicable diseases and injuries, which will follow the launch of the baseline report of the NCDI Poverty Commission. Non-communicable diseases, or NCDs in brief, and injuries have increased in recent years, accounting for almost half of deaths in low-income countries today. Many of these deaths are due to treatable conditions, especially in children and young adults, and are hence preventable. NCDs and injuries in the developing world have received increasing international attention, but often the poorest populations do not yet receive adequate attention. Therefore, a report like this one we are launching today that is looking at gaps that can be addressed sequentially is a great advocacy tool for resource mobilization, not only for financial resources, but for skilled human resources. Ladies and gentlemen, let me point out a few key steps that need to be taken going forward. Of course, earlier on, you had a presentation of the work plan, but this is just a summary of those steps that we think should be taken going forward. So one is the development and adaptation of packages of care for NCDI to be implemented at the various levels of care. We need to be more aware of preventative action to delay onset of some of the NCDs. We need to ensure regular monitoring of the prevalence of the NCDIs, especially in the young population. We also must make sure that we include the key indicators into the health management information system and other regular data collecting tools to make sure that we monitor and evaluate what is happening in the NCDI space. But also, we must conduct regular stepwise surveys. We had one in 2017, and one is due this year, 2022. This survey is an important opportunity for monitoring NCD prevalence nationally, and is an opportunity to incorporate monitoring of prevalence of injuries too in the same tool. Ladies and gentlemen, let me reiterate WHO's commitment to supporting the Ministry of Health and our implementing partners like CIDAS in the implementation, monitoring, and sharing of knowledge as the ministry endeavors to improve the quality of health for all through the provision of quality health care. May I take this opportunity to thank the organizers for inviting me to this important meeting and giving me the privilege of handing over the document to the peers. I thank you. God bless you all. God bless our beloved Zambia. Thank you.
You can see Professor Gasonga is really from the academic world. You know, may I just take this time, ladies and gentlemen, to call on our guest of honor, the PS Technical Services, Professor Gasonga, to give us his speech at this occasion.
Thank you very much, the Master of Ceremony, Professor Goma. Now, I will start by apologizing for my late coming. I know I'm from the academic world, like Professor Goma, we shared lots of happy moments together. And we would always complain when we invited a politician to an occasion, and they would come 1 hour, 2 hours late, and then we would be wondering, what are these people made of? Why is that they commit themselves to coming at 9 o'clock and come at 4:30? I'm not saying I'm a politician, no, I'm only a PS and still remain very technical, and but I work in the political space now, and I'm starting to understand why politicians, they say they don't come late, they get delayed. They say I was delayed. So I will request for forgiveness to you also, stating that I was delayed elsewhere. Now, I saw as we are taking the pictures, the WHO country representative asking me to remove the mask from my face. And then I wanted to resist. And I said, this is the only man who can tell me to remove the mask. So let me do that. He's the only man who can tell me to remove the mask, because first of all, I'm a fellow that is standing on platforms and encouraging everybody to wear a mask because of the COVID intervention, and advising everybody to follow the 5 golden rules. Now, these are 5 golden rules that are enforced by the WHO. So when I say he's the only man who has the authority to allow me to remove the mask, I obliged. I will hasten to recognize the people that are present here, starting with Dr. Nathan Bachaita, the WHO country representative, who, together with me, we continue to champion a lot of health agendas in this country, and without whom I cannot effectively function in my capacity as Permanent Secretary or Minister of Health. I'm always indebted to the SIDA's Chief Executive Officer, Dr. Izokanji Sikazwe, again, another very effective lady who helps my work very easy a lot of times. Professor Goma, we have a background, we share an academic background, and we've come a long way and will continue to do so. I salute you together with the Commission for the enormous work that you've done on this report. I recognize also representatives of cooperating partners and civil society that are here, distinguished ladies and gentlemen. Of course, not forgetting the Fourth Estate, the members of the press, for continuing to disseminate valuable information that we academicians and the Ministry of Health continue to share with members of the public. Firstly, I wish to congratulate the members of the Non-Communicable Disease and Injury NCDI Commission for the commendable work done in producing this report. The NCDI Poverty Commission was tasked to facilitate analysis of the burden of NCDs and injuries in the country in terms of fatal, non-fatal outcomes, as well as risk factors, risk factor attributions. It was to comprehensively review health policy documents, look up data sources, literature search, and conduct a secondary analysis of global burden of disease and the survey data that is available in Zambia. I note the delay in producing this report, which has largely been attributed to the COVID-19 pandemic. The report is finally here and it's ready. We must begin by acknowledging that the national burden of non-communicable diseases are a major health concern. And also, there are a huge strain on our healthcare system and the national economy at large. The NCDIs are fast replacing infectious diseases and undernutrition as leading causes of morbidity, disability, and premature death in developing countries, including ours. NCDIs kill around 8 million people every year, accounting for 68% of all deaths worldwide and causing half of all global disability. Low and middle income countries like Zambia are hit the hardest, with over 3/4 of all deaths occurring in these countries. According to the WHO Zambia NCD profile, NCDs account for 23% of total deaths in 2018. In Zambia, NCDs are among the top 10 causes of mortality. Cardiovascular diseases accounted for 8%, cancer 4%, chronic respiratory diseases 1%, diabetes 1%, and other NCDs accounted for 8%. The main NCDs comprise cardiovascular disease, cancer, diabetes mellitus, heart disease, stroke, chronic respiratory diseases, hemoglobinopathies, and these included sickle cell disease, mental disorders, oral diseases, eye and ear disorders, violence, and injuries, including RTAs, road traffic accidents. There are 4 main behavioral risk factors, namely tobacco use, unhealthy diet, insufficient physical activity, and the harmful use of NCDs. Poverty remains an overarching platform from which most of these rising factors sprout, while the NCDs are also root causes of economic stagnation and exacerbation of poverty. Reducing the burden of NCDs is therefore essential to the fighting of extreme poverty, reducing inequality, and improving health and well-being. The United Nations for Sustainable Development Goals 3, SG3, targets 3.4 aims by 2030 to reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment and promoting mental health and well-being. In Zambia, the rate of progress towards mitigating the devastation of NCDs has not been optimal. The imperative for action is reinforced by persistent gaps and shortcomings in the response, ranging from lack of prioritization of NCDs, inadequate resources, inadequate preventive action, a vulnerable health system unable to respond to the growing burden, and an absence of the voice of people dealing with NCD or of NCDIs in the response. Most low and lower middle income countries have not had the domestic resources to address these conditions, and the external financing for NCDs prevention and care has been minimal. As a consequence, Coverage of NCDI interventions has been very low among those living in extreme poverty. In order to identify solutions and mobilize support to address the problem, countries began to organize national NCDI poverty commissions in collaboration with the Lancet Commission of Reframing NCDIs for the Poorest Billion. Zambia did likewise and appointed the Zambia NCDI Poverty Commission in 2018, whose report is being launched here today, this afternoon. The NCDI Poverty Commission report will therefore serve to elevate an emerging NCDI recovery movement and help develop accountability mechanisms to ensure that service delivery for NCDIs is a key component of the universal health care for the poorest population. It is also to provide a platform for joint learning and help attract funding for service delivery. Allow me to share the key findings and recommendations from the report. Firstly, the cost of the intervention. The total cost of incremental cost of all interventions to reach the target coverage has been estimated at just over $393 million United States dollars. This translates into a total capital cost of $22.64 US dollars during the 5 years and is equivalent to 32.8% of the total health care expenditure, or an annual incremental cost of 2% of Zambia's gross domestic product GDP. The report comes at an opportune time when the budget planning cycle is in the early stages. While there is cost to action, there is a great cost for inaction, which must be averted. There is need to invest in all recommended intervention packages, as investing in them will help reduce premature mortality and thereby save more lives and help avert many more cases of NCDIs over time. This will provide Zambians with more healthy life years and a generally healthier population. 2, we acknowledge the need to invest in health facilities in respect of readiness to manage NCDs. We also note that it takes for the health facility to attain a mean index higher than the 70% cutoff in the PN project report, and further note the rural-urban inequity with regards to medication needed to manage NCDs. There will be a deliberate effort made towards equalization. 3, the Ministry of Health commits to restructuring its health system approach towards NCDIs services and will implement significant adjustments to allow for community outreach, early diagnosis, and optimal care at the primary care level. 4, there will be facilitation to enhance information gathering on NCDs in Zambia, and we will prioritize research and evidence-based practices in both policymaking and clinical practices. 5, there will be enhanced health promotion. This will require intentional and deliberate actions to provide information and related health promotion services to the public. 6, the Ministry of Health stands committed to facilitating processes for the centralization of the multi-sectoral response recommended to be hosted at the level of the Office of the Vice President, as NCDIs have inadvertently attained a disaster proportion. 7, there is need for strong civil society engagement in seeking solutions towards NCDI mitigation, and we will work towards attaining that. People living with NCDs are key stakeholders in this process. 8, universities and research institutions will expedite research activities in NCDI arena and bring the Zambian database up to date. I do call on our cooperating partners in health to deliberately increase funding to research and data collection processes. We shall, within our means, contribute to funding for research as we continue to insist on building on evidence-based platforms. I further note the commitment of the NCDI Poverty Network in obtaining local evidence as shown in the funding that has been granted for the PN Plus project. This is very timely delivery, and I look forward to the results of this project, which will give us precious information that will be necessary in the process of altering our programming to refocus our health systems towards NCDI at primary care level. Sincere thanks to the Commission once again for this very great work. We now look forward to regular updates on the implementation of the next project, the PEN Plus. I thank you for kind listening, and God bless all of you. Thank you.
Thank you very much, PS, for that speech on the launch of this great report. We will just now invite you for a photo shoot outside, and then we invite you all for lunch thereafter. I think PS has already said the most important thing, and that is what is going to follow in the implementation of this report. So, commissioners, thank you very much for being here and for doing your work to this day. Thank you very much, and thank you very much indeed. So a photo shoot just outside. So please sign a copy of your report so that they see that you actually have a report in hand. All the reports, please collect the report from here. Oh, the photo.
Want to check if everything is ready. So there's a lady.
Excuse me, sir. But speaker appears. Number there. Soft copy.
But you people are the one who's supposed to provide soft
Yes.
copy.
No, we sent you, but we don't have the final.
Hey, but
The final.
so you don't have a final
The
one.
final.
Oh,
Yeah.
perfect. So what these guys are doing, yeah, I'm quiet. Dining.
Robert.
It's Bachaita. KYH. So KYH.
Okay, first of all, I want you to understand that
Sorry, sir, it's a side interview. It's an exclusive
yeah.
interview. Sorry.
Yes, so I want to state that
It's okay.
Zambia has been honored with the privilege of hosting the African Union Media Summit 14 to 17